Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs, brought to you by Lucid Quest. Coartem Baby has been approved in Switzerland, marking the first malaria treatment for infants under 4.5 kilograms. Developed by Novartis and Medicines for Malaria Venture, it addresses a critical treatment gap for newborns. With 597,000 malaria deaths reported in 2023, mostly in young children, the drug is expected to roll out soon across Africa. Helicobacter pylori infection has been linked to 76% of future stomach cancer cases, potentially accounting for 12 million cases globally. Stomach cancer already causes approximately 770,000 deaths per year, often due to late detection. Sub-Saharan Africa could see a six-fold rise in cases by 2101. Researchers are calling for global screening and early treatment efforts. A new study shows that probiotics may help reduce hyperactivity in children aged 5 to 9 with autism and ADHD. Specific strains were found to influence dopamine and GABA pathways, improving both behavior and physical comfort. While results are promising, larger and longer-term studies are necessary to validate these effects. Personality-tailored exercise programs are showing strong benefits. Extroverts respond well to high-intensity interval training, while individuals with high neuroticism see the most stress reduction from low-pressure activities. Participants in all categories experienced gains in strength, fitness, and adherence. Colon cancer rates have more than doubled in adults under 50 since 1950. This alarming trend is linked to rising obesity, unhealthy diets, and changes in gut bacteria. Colorectal cancer is now a leading cause of cancer death in this age group. Experts urge earlier screening and improved awareness to combat the rise. A major autism study has identified 5 biologically distinct subtypes of autism spectrum disorder. Each subtype is defined by unique genetic and brain structure patterns. These findings could explain the variability in treatment responses and pave the way for more personalized diagnostics and therapies. A recent JAMA review is under scrutiny for underestimating the severity of antidepressant withdrawal. Long-term users report prolonged symptoms and difficulty tapering off, with up to 80% experiencing significant challenges. Experts are calling for better data, improved guidelines, and public education on the issue. Researchers at Stanford have developed a blood test that estimates the brain's biological age. Results show that a more youthful brain is linked to a 40% reduction in mortality risk, while older-appearing brains are associated with a 182% increase in risk. This test may also help detect Alzheimer's disease earlier and could see commercial use in the near future. New research shows creatine is essential for brain health, not just muscle performance. It plays a key role in memory, learning, and seizure control. Scientists have developed an ultrasound-based delivery method that bypasses the blood-brain barrier, offering hope for patients with creatine transporter deficiencies. Finally, an experimental mitochondrial therapy has saved the life of an 8-year-old with a fatal gene mutation. Daily doses of 4-hydroxybutyrate restored the child's cellular energy production. Once wheelchair-bound, the child is now active again. While more studies are needed, this case highlights the promise of precision medicine. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com.